through the years, I've been involved with numerous couples in getting pregnant. If you ask me how many couples have I helped get pregnant, it lists in the thousands at this point. And unfortunately, not everybody gets pregnant. But if you take a look at national statistics, ours are one of the best, certainly in the Metroplex. There's certain locations where patients can find our statistics, and you can look online. You can look at cdc.gov, SART.org, and so there are a number of organizations where you can actually compare apples to apples, which I think is important for couples, because not all fertility centers provide the same services. We strive very, very hard to obtain the best possible pregnancy rates, but by the same time, you need to consider who are these doctors treating. So in other words, if I have a patient come to see me and their prognosis to get pregnant is not very good, I will not turn them away. I will help them understand what their current situation is, help them understand what their expectations should be as far as getting pregnant, and help them any way possible. There are a number of centers that you would go to that would say, nah, you got a poor chance of getting pregnant, you're going to skew our statistics, and so we won't be able to treat you. We don't take that philosophy. The reason we don't take that philosophy probably has to do with my own endeavors in having a baby. We had a difficult time in conceiving, and if a doctor told me, I'm sorry, you have a low chance of getting pregnant, you can't come here, I would have gone somewhere else. I think adults are able to synthesize and understand what their situation is and then determine whether this is something that they should pursue. So I've had patients where I'll tell them they have a less than a 1% chance of getting pregnant. They go, you know what, we want to at least give it a try. Would you help us? And we will. And I've seen pregnancies in those situations as well. So it's not a dead-end situation. If it is, then certainly we're not going to be unethical and provide treatment for situations where there's really no hope. But I think if we at least provide the patients with expectations of what their chances of getting pregnant would be and then give them that opportunity, I think they can at least move on with either their family balancing plans, whether that would mean adoption, maybe not even having children, or maybe some other alternatives that we are able to provide for patients here. I think we can help them through that process, and in some situations they get pregnant as well. Certainly our younger patients that perhaps have other diagnoses such as blocked tubes where they do in vitro fertilization have a very, very high chance of getting pregnant, for example, with in vitro fertilization. So it's a case-by-case basis on how we treat patients. If you would say what would be treatment options for couples that come see us at Fort Worth Fertility, we tailor their treatments based on their situation. So we would do diagnostic testing. After diagnostic testing, and once we figure out what their reasons why they're not getting pregnant, what we do is say, okay, let's look at your treatment options. We'll go A, B, C, D, and then outline these treatment options, have them understand what their chances of getting pregnant would be, what their financial obligation would be, what they need to go through both physically and emotionally.